Welcome, everyone. My name is Dr. Jeremy Thornton, joining you from Southwest Missouri. And just a little bit about me. I am a chiropractic physician. I'm board certified internist, board certified clinical nutritionist. Been in practice now. I believe I need to add it up, right? I think we're at 26, somewhere between 26 and 28 years. I'm old enough that I have to go back and count when I started practice. But been in practice a while and in the nutritional space and the functional medicine space. And I've seen a lot of nutritional supplements over the years, and used a lot of nutritional supplements. In fact, I had used other so-called natural peptide products and just honestly was not impressed by the things that I was seeing. And honestly was not terribly excited to try this product. I just didn't have a lot of faith. Very skeptical by nature when it comes to new supplements, new technologies, especially in the peptide space, because we hear so much. There's just so much talk out there. And so, but because of a friend of mine that shared it with me, I tried it and actually tried it over the holidays, which is probably not the best time to try a product for weight loss, although it's much more than that, as you know. And ended up losing weight over the holidays instead of gaining weight, and that was not expected. And so, I that got my attention enough to look closer at what this is, what it does, what's in it, the ingredients, the science. And the more that I studied, the more excited I was about the opportunity that this can have for so many people. And so, we hear a lot about GLPs. Here in the United States, it's like every other commercial, it seems like, is about a GLP-1 medication. And we're going to actually talk about three pathways with one ignition. Now, the GLP-1 is by far the most popular, the most known about, the most talked about, and it is a very important pathway. And when we hear the term GLP-1, how many people automatically think of a drug? Right? They hear GLP-1, they think of the injection, right? And that's very effective marketing, by the way. But GLP-1 is not a drug. Actually, it's a natural hormone in our body. I didn't know if everybody may not have known that. It's a natural hormone produced in your gut that has far-reaching effects on the brain, on the pancreas, on the gut, on inflammation, on the immune system. And the injections drive the receptors that mimic this hormone in the body very hard. And that's why we see with some of the GLP injectables so many side effects we hear. Would love to know in the chat if you've experienced a side effect of the GLP-1 or know somebody that has. But we see a lot of things with the gut because, of course, the GLP-1 is heavily involved in the gut. So we see a lot of gut side effects, nausea, vomiting, constipation, gallbladder issues, pancreatitis. But now it's becoming even worse than that. We're seeing people with significant muscle loss along with the fat loss, right? And studies verify that up to 40% of the weight that's lost with a GLP-1 can be muscle loss. And that's startling, and it's actually scary. I have patients, or I know patients that have done the shots, lost a considerable amount of weight. A fair percentage of that was muscle. Went off the shots, gained the weight back, but did they gain the muscle back? No, right? It was just fat. They gained the fat back. Still loss of the muscle that they originally lost. Go back on the shots to lose the weight again. And guess what? They lost that muscle again as well. And so now they're in big trouble. Because if we're to lose that much muscle, metabolically, are we better off than when we started? Even if we lost weight, even if we lost some fat, are we better off metabolically? And of course, we're not. We are far worse than we started, even if we did lose some fat. Because if we lost 50 pounds, up to 20 pounds of that could be muscle loss. And that's pretty tragic. But GLP-1, the real GLP-1 your body makes, they oftentimes call it the appetite whisperer. It regulates hunger at the brain level. It does slow gastric emptying for natural satiety, reduces food cravings, promotes sustainable weight loss without effort. It's the one that impacts our body when, when we think the food noise, we hear that term used more these days. And when you find yourself eating or snacking or looking for snacks and you're really not hungry, but it's just on your mind, right? That you need to be eating something. And that's the GLP-1 quiets that food noise. And these drops do support this system, but they don't drive the physiology. They support the physiology. And that's a big difference from the injectable options that are out there. So our drops are tri-GLP drops. They support three pathways in one. One is the GLP-1. The other one is GLP-2. We call it the core shield. It helps repair and strengthen that intestinal lining, reduces systemic inflammation throughout the body, enhances nutrient absorption, supports the gut microbiome, promotes digestive wellness and immune function. Um, with the GLP-1, I think one of the most exciting things I'm seeing, and the GIP, which we'll talk about next, is its impact on insulin resistance in the body and blood sugar imbalances, because that's a major driver for disease. Especially here in America, it's estimated 70% of Americans are insulin resistant. Most don't know it. One in three are pre-diabetic and one in eight are diabetic. And diabetes drives pretty much all of the other major killers, right? Cancer, heart disease, neurodegenerative conditions. Many of these are driven by blood sugar imbalance, especially diabetes. And so it's exciting for me to see, as I'm working with patients in practice, seeing improvements in their blood sugar, in their insulin levels with the use. And I believe it's because of those two pathways, the GLP-1 and the GIP. Now, the GLP-2 is more for gut support and gut healing and gut health. And we're seeing people repair things like leaky gut. We're seeing people have less sensitivities to foods. And that also goes to leaky gut. We're seeing a lot of gastrointestinal issues, inflammatory gut issues, see results from this. And I believe that a lot of that is because we're supporting that GLP-2 pathway in the body and the GIP as well, called the Metabolic Optimizer. It also optimizes insulin sensitivity and glucose regulation in the body, similar to the GLP-1, prevents blood sugar spikes and energy crashes. Just as a personal note, my wife has experienced this benefit. She used to have horrible hypoglycemia, low blood sugar, and she couldn't go more than a few hours without eating before feeling weak and shaky and what she calls hangry, both hungry and angry. Anybody have that? And so she could never fast. Well, she's now, because of these drops, and one of those reasons is because of these pathways, is she's able to fast long term. She's able to do intermittent fasting, and she's never in her whole life been able to do that. And I know that it's because we're optimizing her insulin sensitivity and her glucose regulation with this technology. So we're excited that we have all of these three pathways supported in the body. And we're not driving a single pathway aggressively with a synthetic injectable drug, right? We are supporting this natural physiology. All of these, the GLP-1, GLP-2, GIP, are natural hormones in your body. They're not a drug. And it's nice to be able to support this physiology rather than force it. Um, so key benefits, clinical results, has been studied for over 3 years clinically, 6 to 7% BMI reduction in 6 weeks, 10% body fat decrease, zero muscle loss. I think we need to highlight that, right? Because the alternatives out there can't claim that. In fact, that's one of the main drawbacks, especially to GLP-1s, is so much of that fat or that weight loss is muscle. And we can claim zero muscle loss. 100% fat targeted weight loss. We've talked about blood sugar, sustained energy, and I think a lot of reasons for that. One, the blood sugar, less inflammation, but also the body with that GLP-2 supporting gut healing and repair that epithelial lining in the gut. We are seeing people absorb their nutrients better. And if we're absorbing our nutrition better, it makes sense that we're going to feel better, have better energy, less inflammation. I've been actually shocked at how much this amazing supplement impacts inflammation. It's not something I expected it to impact as much as I'm seeing, and I'm just really pleasantly surprised at that. And of course, we've talked about some of the digestive benefits. Why is this different? Of course, we're talking about the research. We're talking about we're not doing needles weekly, patented bioavailable technology, pharmaceutical grade manufacturing, direct to consumer. We don't have to get a prescription, right? No medical gatekeepers. Um, And, this is for you if you want to lose weight naturally, if you don't like to be poked, if you want affordable GLP support, like a quarter of the cost, suffer from food noise, you want to switch from shots to a natural solution. You want to, and I've seen this be very successful. I've seen people utilize this technology as an off-ramp from the injections, and having support. But because they want to come off of the shots, or maybe they're having some side effects, or they don't want to do the shots forever, right? And this is a great alternative. They want to maintain their weight loss and they want to keep their muscle. And I think that's all of us. Maybe they want to help launch a viral product, and there is an opportunity with that. Those that have an entrepreneurial mindset, these drops are going viral, and we do have the ability to share in a grand scale, and it is causing some major disruption in the nutritional industry, um, especially in the peptide space, because it just works so well. We're only talking about four ingredients: just the salmon peptides, organic lemon peel, organic ginger, and water. It's probably the cleanest product that I've seen and that I've used personally. And I call it Beyond Organic because we have all of these certifications in this one product. The halal certification and the kosher certification, the non-GMO, the GMP certification, all of these are big deals, meaning this product is very well tested. I like to use the term pharmaceutical grade because indeed it is. And I feel confident in that, and it makes me feel good to be able to offer something to somebody that is so clean and so healthy. So why is this perfect timing for a natural product like this? Well, we've talked about the side effects of GLP-1s, and there's about 10% of the populations that are on some type of a GLP drug, and it's estimated 30% are looking currently at GLPs or things in this realm. And we're entering a US market of more than 100 million consumers. And we're just talking US here, 100 million consumers seeking GLP advantages, but hesitant to pursue injectable options. And so, we've talked about the difference of the injectable versus natural, but it's astonishing the market size in the GLP arena. This began at 48 billion in 2024. Just last year was 66 billion, and projected to be over 800 billion in just a few short years. So people need to know about this because it is a safe alternative. And I'm not against injectables. There is a time and a place for these medications, but maybe not the first option, right? I don't know about you, but I would rather try something natural that's pure, that's safe, that's food, right? Before embarking on an injectable synthetic, drug that with questionable side effects, right? So this has been a blessing for me, my health, my family. I've been blessed to be able to share this with lots and lots of others. And that's why we're here today, is to share this with you. And so if you have not tried these drops yet, you've just got to try these drops. Get with a person that invited you and make sure that you try these drops. Um, we have an amazing testimonial group. So if you're not in that testimonial group, make sure you ask for an invitation and we'll get you in there just to see what it's doing for, real people. Not only, we're excited about the fat loss. I was surprised at the other benefits that we're seeing, health benefits, and that's been super exciting to witness. And you'll see in the testimonial group that this is far beyond a fat loss supplement. This is really a complete health transformation supplement. And it makes sense when you see what all of these pathways do. And this product has over 500 peptides in this product. So it's doing things in our body that we don't even quite 100% know yet. We do know about these peptides, about these pathways. We do know about the research that we've done on there, but I think there's a lot of benefits that are yet to be discovered, and that's exciting. So I appreciate you guys for hopping on here and spending this time with me. For me, it's lunchtime. For some of you, it's dinner time. But I'm going to wrap it up here, and then I'm going to open it up for questions. Thank you guys for hopping on. I appreciate you.